In 2003, we saw a way to make a difference, an opportunity to fight avoidable blindness. We were 28,000 strong and committed to funding 28,000 sight-saving surgeries. We saw a challenge, and we surpassed it. We saw mountains conquered, cakes baked, roads run, and finishing lines crossed. Deserts tamed, tires changed, flags waved, and targets smashed. We saw fees donated and hours spent. We saw you giving time, giving money, giving it everything you had. We saw partnerships forged all over the world, each one of them taking us further than we ever could on our own. And we saw our ambition grow to $100 million. Today, we see the impact of what happens when you invest in eye health projects all over the world. We see the millions of lives changed for the better, from operations, from examinations, from training and education, from new innovations, from a simple pair of glasses. In 2018, we achieved our target 2 years early, and we surpassed it. And tomorrow, what will we see then? We will see what they can do, the things they will achieve, the lives they will live. Thanks to you. Seeing is believing.
Hello and welcome everybody to the closing ceremony of Seeing is Believing. I'm Jude Stern, the Head of Knowledge Management at the International Agency for the Prevention of Blindness, based in Sydney, Australia. As I'm presenting from Australia in the local Bondi area, I would like to begin by acknowledging the Gadigal and Bidigal people, who are the traditional custodians of the land on which I am standing and hosting the webinar, and pay my respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples that are joining us today. We are delighted that so many of you could join us today to celebrate the achievements of this 17-year award-winning partnership, which we just saw so beautifully summed up in the video. I am lucky to have been able to have worked on a few Seeing is Believing projects over the last, well, not quite 17 years, but over some years, and in particular child eye health projects. I just wanted to share a short story with you. A few years ago, I had the privilege of presenting the outcomes of the East Africa Child Eye Health Project and was lucky to be able to see firsthand that the successes and the reach of the program were clearly impressive to the audience that we were presenting to. And in particular, the audience really could see the value in the local ownership, key institutional changes, collaborations and networks that were formed during the project. And that featured heavily in the discussions as we talked about certain things around health broadly in East Africa. And I know that the project and the way that it was approached had quite a heavy influence and did indeed lend to further support into developing eye health services in Uganda, and speaks very much to what's next, as the video did in so many of the projects and able to garner support going forward beyond Seeing is Believing. We've had over 200 people register for today's event from over 30 countries, which demonstrates the global nature and the large scale of the SiB partnerships. We have a great mix of attendees from clinicians, program and project managers, ophthalmologists, optometrists, country directors, employees from Standard Chartered Bank, which will lead to some really enriching and lively discussions later on today. We have an exciting day planned ahead, packed with great speakers, interactive activities, and networking opportunities. So let's get started. I'd like to introduce our first guest speaker today, David Fine, the Group General Counsel at Standard Chartered Bank. David oversees Standard Chartered's legal group, corporate secretariat, and shared investigative services functions, and is a member of the bank's management team. He has also served as the chair of the Seeing is Believing project since 2015. Please welcome David Fine.
I'm very honored to open the proceeding and delighted to do so on behalf of all Standard Chartered employees, past and present. our partners, our clients, our supporters for Seeing is Believing, many of whom you saw in the video that you just watched in lots of snippets and lots of scenes in lots of countries and lots of projects. You got to see them. As we're really proud of the partnership with IAPB and to support this event today, and we've got a lot of colleagues participating in this, and delighted to be here. As we conclude this wonderful visionary partnership of Seeing is Believing and bring this chapter to a close, we wanted to express our sincere and deep appreciation and thanks to IAPB for being with us every step of the journey, of this incredible journey. And I want to give personal thanks to Peter and Sally, who you're going to hear from shortly, who I've had the great pleasure of working closely with over the last few years. Our partnership is an incredible example of what can be achieved when the private sector works together with the non-governmental organization such as IAPB and the various eye health NGOs that we partner with government, with communities, to together tackle a major global challenge. This initiative grew out of an employee idea, a ground up idea on how Standard Chartered should celebrate its 150th anniversary that it reached in 2003. And employees incubated different ideas, and the idea that came to be chosen was to raise enough money to perform 28,000 sight restoration surgeries. 28,000 was chosen because that was one for each of the employees at the time. The bank had 28,000, we're now closer to 90,000. But so 28,000 sight restoration surgeries, with the bank matching every dollar that was raised. That was the ambition at the time. The response was so enthusiastic from employees, from clients, from partners and others, that the goal kept getting lifted and raised to higher amounts, ultimately to the point of a goal set to reach 100 million United States dollars, USD, by the year 2020. And that became the goal that we worked toward, that I've been, when I took over as chair in 2015, that was the objective. Well, as you saw from the video, we reached that goal. In fact, we crushed through it, and we did so 2 years early in 2018. And we were very proud to do that, and had a wonderful celebration at the time with IAPB and our other partners. But the work continues. Obviously, we continue to spend the money that's been raised, and we also, we're not going anywhere Standard Chartered, because we have a deep commitment to eye health and continuing to tackle avoidable blindness. We'll do that in different ways, not through Seeing is Believing in the way we've done it up until now, but we do still have Seeing is Believing by Standard Chartered that will support eye health in India, for example, where we've done lots of projects over the years with IAPB, by supporting the Vision Catalyst Fund in its endeavor, audacious and bold and necessary endeavor to raise USD $1 billion in different ways, and through Future Makers by Standard Chartered, a new foundation that we've created that has a number of broad objectives, but includes eye health as one of the pillars of that work. And we want to continue to help facilitate and bring together various players in the sector to collaborate and make do the best we can do to combat avoidable blindness and to address eye health globally. I'm really happy to introduce two wonderful colleagues and people whose lives have been touched by this work, and who feel, I think, as passionately and enthusiastically as I do, and all of you do. The first is our chairman, Jose, and you're going to see, I'm going to introduce a video shortly that will feature two speakers. One is our chairman, Jose Viñals, and it's wonderful that on one of Jose's, I think it may have been his very first overseas board meeting, for Standard Chartered. It was in Kenya, in Nairobi. We had arranged a board engagement session with Seeing is Believing to help use one of our most exciting initiatives that we've supported over the years, the peak technology, to test people's vision in the community on a school holiday. We took over a school and did eye testing, and we had the entire board among and senior colleagues assisting using the peak technology, and Jose presided over that, and that was his first early on in his tenure. And so Seeing is Believing and this initiative reached him and touched him very quickly, and he's been a big supporter throughout, and you'll hear from him in just a minute. And another great supporter and partner in this work over the years has been the Liverpool Football Club. You'll know that Standard Chartered is the primary sponsor of Liverpool Football Club, something we're very proud to do. And Liverpool, in turn, has been a really big supporter of Seeing is Believing and fighting avoidable blindness. One of the things that we've done over the years is one game each year in the Premier League. We've had Liverpool swap the shirts, and we take Standard Chartered's name off the shirts and put Seeing is Believing on the shirts. And that happened for many years. And it was a fantastic initiative, raised money. We did auctions of Liverpool materials, and Liverpool was very supportive and ran programs and hosted events. So we're gonna hear from, after Jose, you're gonna hear from Billy Hogan, a good friend and supporter of this work, and the new CEO at Liverpool Football Club. So we're delighted to have Jose and Billy speak to you. And I wish you really well for the rest of this program, which I'm sure is going to be fantastic. The agenda is wonderful, and the subject couldn't be any more important. So thank you for all your support, and please enjoy a message from Jose and from Billy.
I'm most pleased to be joining you all today in the celebration of the amazing success of this fantastic project, which is Seeing is Believing. The fact that during all this time, we have been able to reach and touch the lives of more than 220 million people around the world, that we have performed more than 5 million sight restoring surgeries, that we have trained more than 370,000 health workers. All of this, I think it's amazing. But none of this would have been possible without you. So a big, big thank you to you all, to AIPB, which has been so crucial for this, to the charities and NGOs who have helped us in this effort, to all the colleagues from Standard Chartered who have taken part in this initiative and contributed in so many different and very generous ways. And of course, to the management committee chaired by David Fine, who has been overseeing year after year, Seeing is Believing. So a big thank you to you all, with my deep gratitude, also that of Standard Chartered. And we are all tremendously proud at Standard Chartered of being associated with this incredible project. Thanks very much.
Hi, everyone. I'm Billy Hogan, the CEO of Liverpool Football Club. Over the past 10 years of our partnership with Standard Chartered, we've been humbled to be able to use our global platform to raise funds and awareness for Seeing is Believing, which is such an incredibly worthy cause. A couple of highlights I'd just like to mention. Firstly, when our legend Ian Rush was invited to attend a cataract operation on a young boy in Kenya. And to this day, Rushy still recalls how moved he was to meet a young boy who went in with a visual impairment that was holding him back and came out fully sighted with his whole future in front of him. Secondly is our annual first team logo swap, where the players sign their Seeing is Believing shirts, and Standard Chartered auctioned them off after the match. And it was incredibly moving to see young visually impaired children take to the field at Anfield and take penalties in front of the cop against Sir SiB. The Seeing is Believing program has been remarkable, and Liverpool Football Club is proud to have been a small part of its success. So we just wanted to send our congratulations. Well done to everybody, and all the best for the future. You'll never walk alone.
Thank you, David and Jose and Billy, and to everyone that's been involved from the Standard Chartered Bank. Listening to you and looking at the video, it's quite an incredible reflection of what people can do when they band together and have a mission in sight. But now it's time for our second speaker. Our next guest today is Peter Holland, the Chief Executive of IAPB since May 2018. At IAPB, Peter is taking the lead at the global level to promote eye health and to ensure its critical importance to the delivery of the UN Sustainable Development Goals. Peter is a member of the Seeing is Believing Management Committee. Over to you, Peter.
Jude, thank you very much indeed for introducing me. And David, thank you so much for your inspirational words for us this morning. Like you, I'm really delighted to join everybody today. I guess we all share the same link, the link of seeing is believing. And I'm particularly pleased to be able to join you today because IAPB has partnered with Standard Chartered for the past 12 years, and indeed Seeing is Believing itself has existed since 2003. So really, I think the first thing for me to do today is to thank Standard Chartered on behalf of IAPB and particularly on behalf of our members and the eye care sector as a whole from around the world, who've been able to deliver and improve eye care services over that time, thanks to the generosity of the bank, your employee and your employees, who've raised half the money, which was then matched by the bank itself. Many of our members, many of the organisations in the eye care sector around the world have really found that funding to be a game changer. We'll see two short videos shortly, and they'll show some of the projects that have left a real and varied legacy around the world. And I'd also like to take this point, the opportunity to thank in particular the Standard Chartered team in London, led by David, but also Julie, Victoria, Kate and Marina, who I'm sure are on the call with us today, who we've worked with so closely over the past years and who've made such a contribution themselves. And also particularly the Standard Chartered country teams, who've been such enthusiastic and supportive advocates for Seeing is Believing on the ground. Your contribution has gone well beyond the money you raised. And we've seen that particularly, I think, with the commitment and support from employees of the bank, really throughout the life of Seeing is Believing, because it hasn't just been about the money. People really from the bank around the world have been fantastic advocates over many years, and particularly helping support communications around the importance of eye health in their own countries. We've seen on World Sight Day, bank employees come out to support events such as the Walk for Sight from Lagos to Colombo. And of course, there are the many marathons that the bank has sponsored and supported, which have also directly promoted eye health to national and global audiences. So I'd really like to give a heartfelt thanks to all the staff who made all this happen, from ourselves at IAPB, but I think also from all the partners and ultimately from the final beneficiaries. I'd also like to take the opportunity with many of the partners on with us today to thank you, the partners who delivered the projects that have made such a difference. Of course, without you, we wouldn't be here. It's your expertise, your commitment to improving eye health that's made such an impact to so many lives. And we'll of course hear from staff from across Seeing is Believing projects in the sessions later today. Because I think, as David said, Seeing is Believing was really an example of a true partnership. And that's reflected in its enduring nature and the fact that this wasn't a one-off short-term piece of corporate social responsibility support. It grew and developed over the years into really a true strategic partnership between the Standard Chartered Bank and the eye care sector as a whole. Because we shared one aim: to prevent avoidable blindness. And as the bank increased its fundraising targets over the years, This enabled IPB members to align their Seeing is Believing projects with the Vision 2020 agenda at country level and deliver more ambitious, more impactful projects that improved eye care services for the communities and the countries which they served and where the bank worked. Seeing is Believing was always mindful of getting the best value for money for eye care delivery. Originally, it supported cataract surgery through the purchase of low-cost IOLs. But as the scale of the programme grew, the whole health system was supported to enable a more sustainable eye care service to develop that would last long after the end of Seeing is Believing. And it stretched into new areas. In phase 4, Seeing is Believing challenged organisations and our members to consider the urban marginalised communities and to help improve access to eye care for those living in urban slums. That indeed was a target population that many of our members and many eye care organisations hadn't considered before. And for phase 5, Seeing is Believing challenged members again to work in collaboration and to improve the eye care system as a whole for children. So across the years and the various phases of Seeing is Believing, the project has developed and grown. And much has been learned. Those lessons are really important because they will be the legacy that lasts long after the programme itself has ended. So it's really critical that we don't lose that learning, that the lessons from Seeing is Believing remain long after the programme is closed. So our new IPB website, which we've just launched, on that website, we're providing a platform to showcase the learning and share all the research and reports that have been generated across the various projects. And here are some examples of what it looks like. And you can see coming up the website and the platform that we've begun to develop to really highlight and show the learning that have come out of the Seeing is Believing projects and programs. I'd like to finish by finally thanking one final group of people. I have to thank the Seeing is Believing team at IPB, Sally, Neve, Sarah, and Susan, who left earlier in the year. Particularly, let me single out Sally, who's been really the face of Seeing is Believing for many of the organisations who you know for over the past 12 years. You'll know her well, but she has really been the face of the programme and the link between the bank and the projects on the ground. Without her expertise, I don't think we would have achieved anywhere near what the programme has achieved over that period. So I'd like to thank that team and particularly thank everyone at Standard Chartered for the bank and our partners in the projects and programs around the world who've made Seeing is Believing such a success. Thanks very much, and I'll hand back to Jude.
Thanks for sharing your thoughts and some of the history, and I have to concur with a huge thanks to Sally and the team across the whole project, but also particularly for today and the exciting agenda and speakers they've managed to pull together. Okay, so now that we've heard from our two of our keynote speakers, it's your turn to do some thinking, and we're going to have our first quiz for the session. So first question, how much was raised for Seeing is Believing through Run for a Reason in 2015? Run for a Reason covers all the marathons the bank supported across the world and across the years, Hong Kong, Nairobi, Jersey, Falkland Islands, and others, and also running events such as the Great City Race in London. But this total did not include all the additional funds raised through cycling, through the Cycle for Sight, which was equally as impressive in the US, UK, and Taiwan, for example. 53% of you chose the correct answer, $933,000, which is very impressive. Okay, we'll move to the next question. What was the highest price paid for a Liverpool shirt in 2015? Again, an innovative way to raise funds for eye care. Liverpool Football Club certainly delivered. As a background, the shirt that made this amount had been worn at the match by Steven Gerrard. Let's look at the answers now. We had most people voting for £23,000, and the answer was £18,000. Which year raised the most money for Seeing is Believing? 2018, 2012, 2010, or 2015? We have the most votes for 2015, and then 2018 is the next highest group, and 8% said 2010. 2012, wow. So for those that were on the call that have been around since 2012 and were involved in fundraising then, can certainly be very proud. How many projects did SiB fund in total? So 200, 183, 276, or 237. Some pretty specific numbers there. So 276 got almost half the vote. 237 came in close second. Let's see what the right answer is. 237 projects in 38 countries. Like the previous question, this demonstrates how Seeing is Believing has really made a difference over time, but also that multiple projects have been delivered across 38 countries. So Seeing is Believing has enabled many partners to learn and develop together over the years. Next up, we'd like to show you a short video. We asked some of Seeing is Believing African projects partners, what is the legacy of Seeing is Believing? And here is what they said.
With the support in developing infrastructure, human resource, use of technology, what we see now is sustained increased demand for eye care. And that's the legacy that I remember Seeing is Believing for.
The Seeing is Believing project is leaving such a great legacy here in Zambia through its contribution towards breaking some of the gender-related barriers.
Before I started wearing my specs, I used to tear a lot the time I was studying, but now I started putting my specs, I stopped tearing.
It has introduced a very unique and exciting opportunity for youths with albinism and low vision, with over 50 youths who have been empowered with skills. For the great work you have done in Zimbabwe and beyond, thank you to IAPB and Standard Chartered Bank. We will continue to cherish your legacy.
It's great to have a look at people's statements about the greatest achievements of SiB in Africa. And it's really great to see that in addition to the eye health achievements, things that were highlighted were around gender, youth, and skills and capacity development for low vision, seeing how broad the outcomes actually were. Our last speaker this morning really needs no introduction, Sally Crook. Sally has been the Program Manager for Seeing is Believing for the past 12 years, based at the International Agency for Prevention of Blindness. Sally joined SiB in 2008 at the start of Phase 4, never dreaming that she would see it through to the end of Phase 5. But here she is, and we know how phenomenal she's been. Sally, over to you.
Okay, thank you, Jude. And good morning, good afternoon, good evening to everyone who's on the call today. It's just wonderful to have you all here with us today. Because today is all about celebrating as we move to the imminent closure of Seeing is Believing. So also taking the opportunity today to share what has been gained and what we have learned to date. And that will hopefully be useful for all of you who continue working in the eye care sector in the future. In this morning's session, we are looking back, and for me, it's a time for reflecting on the Seeing is Believing projects and thanking all of you, the partners, for all your hard work across the world and across the years to create this success that was Seeing is Believing. In Phase 5, we had 21 international and national organizations as direct recipients, with many more sub-recipients, plus all the locally developed projects and the innovation funded projects as well. And, you know, thank you to so many of you for taking the time to be with us today. Previously, Seeing is Believing was able to conduct learning events at both the end of Phase 3 and of Phase 4, his Phase 4 project learning team. And many of us had planned to meet in 2020 at the GA 2020 in Singapore. And it really is a great disappointment to all of us and to me personally, that in this final year of Seeing is Believing that we cannot all meet up together again. And so we cannot thank you face to face, and we cannot, you know, interact with you, but also an opportunity to learn together from this program has been missed. At the last GA in Durban, we had mid-level staff who joined us, which I was absolutely thrilled about, and they really did a great, they really appreciated the learning. The next slide should have come up by now. The following 3 sessions today are much more interactive opportunities for you to participate and learn from each other. But how can I replace the interaction of a, face-to-face at the GA with a 10-minute talk now, when Seeing is Believing will be closing in 4 weeks' time? So, we've had the wonderful numbers of what we achieved, the millions of surgeries, and I am very impressed with the over 370,000 staff trained. The sheer size shows how, Seeing is Believing had ambition and really delivered on it. And, we do leave Seeing is Believing with a much greater impact on the eye health sector than just individual patients. And I think we have provided a great, robust foundation for eye care services and models for staff training and so many things going into the future. So to structure my 10 minutes now and how you have all achieved all of this, I've gone back actually and used the 3 pillars of Vision 2020, the stool, the 3 legs of the stool, because I do think we've really delivered across these 3 sectors. The first one was evidence collection. And I think Seeing is Believing, you really have done fabulous work in improving data collection through all the baselines that have been conducted, the RABs, the RAB-DRs. We've even contributed to national surveys, eye health system assessments, situation analyses. It's really been so relevant, both for project development, but also in some cases nationally. It's provided them with their first national data. And also just the scale of some of the projects, the amount of screening you've done means that you've got a better idea. After screening 1 million or 500,000 school children, you've got a much better idea of what are the issues in your country or your district. We've also done a lot more work around CAPS to help in planning clear communication plans, developing strategies. And although only a few of you have got round to doing follow-ups to find out, did your intervention hit the spot, I think we've really improved on that. And also just general data interrogation. Why do we still have quite high levels of patient dropout across their pathway for both ophthalmology and optometry projects? So what's happened? But as Jude said as well, I'm really pleased about the gender disaggregated data that we collect now. And this has really helped to improve access and equality issues in eye care projects. And gender is also relevant for children's services. Only 40% of child cataract surgery SiB funded was on girls compared to their brothers, and only 3 countries where there was not a boy preference. And those 3 countries were in Africa and Asia, so it can be done. And also we've just supported HMIS development, and although it was often starting from a low base, I think we're getting there. And we're also improving quality data collection, such as cataract surgical outcomes. The next leg of the Vision 2020 stool was around human resource development, and that has already been mentioned. You saw the numbers. We've invested heavily in human resource development. We've moved this from a nice to have to an essential to have in project design and budgets. And you, the partners, have delivered and organized fantastic training for a whole eye care team. And this has ranged from the short courses for the community health workers all the way through to putting medical staff through 3 or 4 years of ophthalmology and, full fellowships, including subspecialisms, refractions, low vision training, and also all the key support staff, the equipment technicians through to the counsellors, and also working with the Ministry of Education and training huge numbers, and that's, to assist with school eye health screening for, just getting through the screening at the schools. And the bank staff were included as well in a lot of this training, and it's just fantastic. Also staff from disability organisations to help with screening older age groups such as elder clubs, and also general community members. You name it, you've delivered training on it, and I think it's been fantastic. And then getting training tools and quality standards approved and accredited at national levels, that's also been wonderful. The domestication and rollout of new tools such as the WHO primary eye care manuals. And I would say you've all embraced, the move towards task shifting agendas, and you've really stepped up. So on reflection, when I was thinking about this, it wasn't just the type 1 and type 2 projects that really delivered on the training, but we had some excellent investment through our innovation funded projects. So this was from, you know, PhDs around glaucoma services in Africa, to really looking at online training, virtual training platforms and their translations, especially for DR and general epidemiology, the simulation tools such as Head Start, the other apps such as Boost and Peak and all these things. You know, there was so much going on around training and skills improvement. But for sheer numbers, it was the mid-level and the community staff and the school teachers where Seeing is Believing has made massive investments and improvements, which will stand stead for future eye care service delivery. So then the third leg of the stool was infrastructure development and supply of consumables and other key materials such as communication materials. And, you know, we've given a huge amount of key infrastructure support across primary, secondary and tertiary levels, theatre and outpatient equipment and things, and vision centre establishment, getting equipment for vision centres. But we weren't actually just interested in equipping eye care facilities, but even built eye departments and contributed to building whole eye hospitals. And this is in such contrast to when I started in 2008, when I visited a lot of eye departments at district level in broom cupboards. They were in broom cupboards. And so this whole investment in the infrastructure, I think, is wonderful, and it will assist in improving patient experience, but also helping to improve staff retention and improving access to consumables for adults and for children across both ophthalmology and optometry services, but with a keen eye on unit prices, which again, I think has been a great attribute of Seeing is Believing. So this focus, I mean, it leaves out a lot of other stuff that we've all been working on, but I think this just showcases how busy you've all been and how now we've really improved equitable and inclusive access to eye care services in a much more affordable, efficient and sustainable style. So yeah, behind every number, there's a whole pile of work, hopefully teamwork, that has been required to get there. So thank you, to all of you for all the hard work across all your work. And we just don't have time to mention everything in this short time this morning. We are all learning and growing together. And I think, as Peter highlighted, we've accumulated a wonderful resource, a library, that I hope you will all continue to access and use in the future. And the more formal articles and research and things, but also all the grey literature that we've got, which I think is very underused and excellent. Because as many of you know, I hate reinvention of wheels. And so later today, that's what the whole session is all about, sharing your learning, making connections. Also, as has been mentioned, the bank staff in country really hugely helped in raising the profile of eye care at national levels, often linked to the fundraising, such as the marathons and the cycle rides and things, but it has all generated wonderful publicity. And I would say, I think the link into national media has been really helped in some countries with the bank. Carmen and myself, we were in Kenya one year at perfect match time, and I must say, you had it covered. You couldn't open the newspaper from the back or the front without stumbling across a lot about eye care and eye care services. So thank you to Standard Chartered staff for all your support to improve the visibility of eye health services. And I'm also now very quickly just going to thank Neve and Sarah, who are working here at IPB on Seeing is Believing at the moment, and also Susan, who I hope is on the call out there somewhere. And again, we are a team. And so also thank you to Victoria and Kate from the bank. And I also believe Jeanette and Carmen are out there somewhere as well. So thank you to you in earlier years. But for me, the big thank you is to all the project staff, program, clinical, managerial, who've planned and delivered and are still planning and delivering eye care systems improvements and services. And you have responded to all the demands from Seeing is Believing that we've put on you over the years. And so many thanks to you all. It's very disconcerting not being able to see you all, but thank you to all of you for everything you've taught me. And I will sum up Seeing is Believing in 2 words: teamwork. And so a big thank you to this big team that is Seeing is Believing, from me and from Pono. And now we're going to move on to another video, and this time it's from Asia.
It has been a privilege to be part of the SiB supported GSI initiative, the mentor-mentee relationship to make a difference to needless blindness. What a wonderful idea that a mentor walks alongside you to show what you can do.
We really appreciate Standard Chartered Bank's Seeing is Believing program. We were able to restore sight and find the main causes of avoidable blindness, such as cataract, refractive error, and diabetic retinopathy.
The Vietnam Child Eye Care Project, funded by SiB, contributed to strengthen the relationships and collaboration between Department of Education and Training and Department of Health in the United States. I want to say thank you.
I would like to thank Standard Chartered Bank who supported us with Seeing is Believing program.
Thank you, Sally, for such a wonderful summary. It's hard to summarize so many years and achievements in such a quick time. You know, you've done a fabulous job, and I'm sure we'll be celebrating for a long time to come. We have a really quick, we're going to do it as a really quick quiz because we're almost out of time. Okay, question 1. In phase 5, how many school children were screened? 4 million, 18 million, 11 million, or 7 million? Impressive numbers any which way, but how many were screened in phase 5 only? Phase 5 projects commenced in 2013. School screening identified children with both ophthalmology and optometry needs, so eye care needs across the spectrum. Definitely 11 million was the most popular, and it is the correct answer, and that is truly phenomenal. Let's move to the next question. What percentage of cataract surgeries were performed on women in phase 5? I think Sally might have given this answer away if you're listening earlier. So is it 55%, 50%, 49%, or 51%? Almost half of you said 55% were performed on women in phase 5. Well done. This was kept in the positive territory by some key projects, particularly across Asia. Many projects delivered more surgery on men, and the situation for girls globally remains grim. Only 43% of surgery on cataract was on girls as opposed to boys. And this is, a key reason why we need that disaggregated data. What was the maximum SiB investment in a child eye health project? Was it 6 million, 3 million, 5 million, or 4.5 million? Definitely, again, just over half said $5 million. And $5 million was right. This meant that the 20% matched funding, the child eye health projects were, with the 20% matched funding, child eye health projects were actually $6.25 million. And these projects were in China, East Africa, India, Indonesia, and Nigeria. How many innovation projects did SiB fund? Was it 35, 50, 48, or 44? So almost half of you said 48 projects. Close. It was 44. Congratulations to those of you that got that right. And final question. In phase 5, how many health workers were trained in total? Approximately 250,000, approximately 174,000, approximately 332,000, approximately 454,000. Approximately 332,000 was the majority vote, and the correct answer was 250,000. So thank you to all our speakers today and to everyone for your participation. We hope you enjoyed this first session. I'd like to thank Sally and Neve for letting me be part of this wonderful celebration and offer my congratulations to everyone involved on all the achievements in the SiB projects and fundraising. And I'd like to congratulate you for sharing the learning to leave a legacy for the eye care agenda for the next 10 years. On a personal note, I hope that this is something that each of you continue to do, to share your learning from your projects with IAPB, each other, and the broader eye care sector well beyond the life of Seeing is Believing. Thank you, and enjoy the rest of your day.